1, 2, 3. This is ACIF 99.1 Radio Dazzle. Welcome to the segment Mind Matters, where we delve into the complexities of mental health. I'm your host, Vincent, and today we're discussing the psychotic disorders. Joining me are our resident expert, Dr. Sarah, a clinical psychologist, Karil, a mental health advocate, and Lisa, a social worker. Thank you all for being here.
It's glad to be here, Vincent.
Thank you for having us.
So, to start, let's define psychotic disorders. Dr. Sarah, could you give us a brief overview?
Of course, psychotic disorders are severe mental health conditions characterized by a disconnection from reality. This can manifest as hallucinations, delusions, disorganized thinking, and impaired functioning. They can significantly impact a person's ability to think clearly, manage emotions, and relate to others.
Yes, and it's important to note that psychotic disorders aren't just one condition. There are several types.
Exactly. Let's break down the 6 main types of psychotic disorders. Dr. Sarah, could you kick us off with the first one?
Certainly. The first is schizophrenia, which is perhaps the most well-known. It often involves hallucinations, delusions, and thought disorders. Famous individuals like John Nash, a Nobel Prize-winning mathematician, struggled with schizophrenia but made a significant contributions to mathematics despite his challenges.
Another type is schizoaffective disorder, which combines symptoms of schizophrenia with mood disorder symptoms like depression or mania. A well-known case is that of musician Brian Wilson from the Beach Boys, who has spoken about his experience with that disorder.
Interesting. What about the third type?
That would be delusional disorder. People with this disorder hold strong beliefs that are not based in reality, such as believing they are being persecuted or have exceptional abilities. The late artist Vincent van Gogh exhibited traits this disorder, particularly with his intense paranoia.
The fourth type is brief psychotic disorder. This can occur after a stressful event and typically lasts a month. Symptoms can include sudden delusions or hallucinations. It can happen to anyone, but it's often temporary and may resolve with treatment.
Next, we have substance-induced psychotic disorder, which occurs due to drug use, withdrawal, or exposure to toxins. Celebrities like Demi Lovato have openly discussed their struggles with substance abuse and psychotic symptoms that can accompany it.
What about the psychotic due to another medical conditions?
Yes, this type arises from a medical condition such as brain injury or a serious illness. For instance, athletes who have experienced repeated head injuries like former NFL player Aaron Hernandez have faced severe mental health issues that include psychotic symptoms.
Great discussion. Let us proceed to the pick and answer portion. The first question is, how long does schizophrenia last?
Schizophrenia is a mental illness whose symptoms usually occur in phases. Phase 1, when they start to show up, is called prodromal. In phase 2, the active stage, your symptoms are most noticeable. The last stage is the residual phase, though the active phase of your schizophrenia may last several years or up to decade.
Oh, that's quite long. Next question is, what are the possible causes of schizoaffective disorder?
Most mental health experts believe that the schizoaffective disorder is a variation of a schizophrenia, but the exact cause remains unclear. Current theories suggest that schizoaffective disorder is triggered by a range of factors working in combination, including genetic susceptibility and environmental factors such as stress.
It may be difficult to be in that situation. Another question is that, What is the difference of hallucination and delusional?
We know that delusion and hallucinations are both symptoms of mental health disorders. However, they are not the same. Hallucinations, which are sensory experience that other people don't or can share, while delusions, which are false beliefs that the person can tell are false.
That's difference. One question here is psychosis an illness?
Well, psychosis is a cluster of symptoms, not an illness. So it's sometimes described as losing touch with reality. What's likely happening during psychosis is that the person has disruptions in their thoughts and the way they interpret their thoughts that makes it hard for them to recognize what is real and isn't.
Last two more questions. A follow-up question regarding psychosis. It says here that how is psychosis treated?
Treatment of psychosis usually includes antipsychotic medication. There are several types of antipsychotic medications and they have different side effects, so it is important to work with a healthcare provider to determine the medication that is most effective with the fewest side effects.
Last question. If someone is experiencing psychotic disorder, who is the appropriate professional person that we should consult?
A qualified psychologist, psychiatrist, or social worker can make diagnosis and help develop a treatment plan.
It's crucial to understand that these disorders are complex and vary from person to person. The stigma still exists, and many people suffer in silence. Exactly, Linda. Education is the key. Understanding these disorders can help us support these affected and encourage them to seek help.
Great insight, everyone. As we wrap up, let's remind our listeners, if you or someone you know is struggling with any mental health issues, reach out for help. There's no shame in seeking support.
Absolutely, and remember, recovery is possible.
And yes, we all play a role in fostering a supportive community.
Let's continue breaking the stigma around mental health.
Thank you for all sharing your expertise today, and thank you to our listeners for tuning into the Mind Matters. Again, this is ACIF 99.1 Radio Dazzle. Until next time, take care of your mind and each other.